As dancers, we're used to aches and pains, sort of a healthy dose of ignoring some things and pushing through, but then knowing when something is bad pain versus good pain. The pain in my hip came on pretty slowly, maybe over the course of about a month. It was when I started waking up at night in pain. That was sort of a telltale sign of something wrong in the joint. I had trouble sitting down for long periods. I'd have to stand up because just sitting at a 90-degree angle was really painful. So of course, a little bit of self-diagnosis and Google was like really spot on for labral tear.
As a ballet dancer, specifically, the ranges of motion that you get into are so extreme that it puts so much stress on the structures inside your hip joint. It's actually very common for ballet dancers to have this type of tear in their joint.
Lauren had gone to Dr. Tabaddor, so I knew that's exactly who I needed to go to.
I was seeing my physical therapist at the time for groin pain, and I thought it was something more muscular because it felt that way. And then it just really got to the point where everything hurt. I was aching. I couldn't sit. I couldn't sleep. It just felt like something was stabbing me inside. At that point, it was like pretty obvious. We went and saw Tabaddor. He's really great and calm and listens to you. I was also really impressed by the work he's done with Boston Ballet and gymnasts. It's important to me that doctors, especially a surgeon on such a big joint that's so important to my career, be really aware of and knowledgeable of the full range of movement, not only for stability, but for rotation and kicking. In my head, I was like, I feel really confident about him. I did not feel like I needed to get a second opinion. I knew it needed to happen, and I knew that this was the person that I wanted to do it.
This is like potentially a career-ending type of injury. And so for Lauren specifically, like she was really concerned about the longevity of her career, and we wanted to make sure that she was able to extend her career as long as we can. And by doing this surgery, we were able to do that.
When Margot started having hip pain, I was immediately like, and just thinking like, okay, you just need to make an appointment. It's not something that's gonna necessarily go away, especially if it's gotten to this exacerbated point where it's just like that biting pain when you hit it. It's aching all the time. There's just no, there's no amount of ice. So I just remember telling her like, just make the appointment, you know, just one step at a time, but like get it going.
I finally went to see him a few months later. I had waited a little too long and I had ended up with a stress fracture in the opposite foot. I walked into the office with a boot on my right foot and he looks at me and just kind of goes like that. And he was like, you know, that's totally related, right? And I was like, see, you get it. The minute I made the decision with Dr. Tabaddor to have surgery, it was like nothing but just like hope and sort of seeing the other side.
The procedure is called hip arthroscopy, which means that you're going into the hip joint with a scope to look at it with a camera and then fix whatever is damaged in there. What's nice about it is that it's so minimally invasive. It's just really just two little poke holes to get into a very deep joint.
Recovery was very slow in the beginning, and then it sort of goes like this really fast towards the end, and you kind of shock yourself.
The typical recovery length for a hip arthroscopy is about 4 to 6 months. Both of them were doing actually really great at around 4 to 5 months. At that point, they were able to get back to extremes of motion, dancing, training.
I was able to come off of crutches in a week, and then it was just the slow progression of physical therapy, getting the muscles to communicate again, but then also getting them to turn out and then start to lift.
A lot of it is mental strength. Something I will say to any of my young students is that you're gonna have injuries. To definitely feel the sort of sadness or grief of whatever you're missing out on. And once you've kind of felt that, to try to just switch your mentality to the recovery and the other side and how much stronger you can come back from it.
It's really incredible seeing what the body can do and how fast it can heal and adapt. After getting back to dancing full time, it was funny how different each hip felt. Like the right one felt like fresher and rejuvenated and re-strengthened. It felt like I minus 10 years on one hip, you know.
There are certain patients you just don't forget. Lauren and Margot are definitely patients you're not going to forget. Their attitude, their positivity, their charisma. I am absolutely thrilled to see like how well they're doing. That's the reason we're trying to help them.
I feel 100% with my hip. Perfect time for Nutcracker.
I was very touched by them reaching out to me and inviting me to the show. It's very meaningful to just have that follow-up with these patients and see what they're doing, and the thing you specifically were trying to get them back to really means a lot.
Dr. Tabaddor has no idea how much he means to both me and Lauren, I think. So to have him at one of our shows just, I think, is going to feel like a nice full circle moment. Puts you back into perspective of where you came from and how far I've come.
Thank you for your directness, your patience, really listening to, I know, both of us, and for being so supportive.
Thank you for giving me the confidence to go through this and to return to dancing.